Hello everyone. In this video we'll discuss the important questions and topics repeated frequently in INI-CET exam. So we'll begin from 2019 to 2022. So from November 2019, one of the question was which part of brachial plexus does not give branches. So you should learn brachial plexus by heart. So the answer was division. And you can learn a mnemonic really tired, drink coffee now. So R for roots, that they will lead to trunks, then divisions, then cord, and then nerve. So division of brachial plexus does not give any branch. So now next question. Which structure crosses the ischial spine? That was an image based question. So you have to learn the mnemonic pin, pudendal nerve, internal pudendal vessels, and nerve to obturatus internus. So these three structure crosses the ischial spine. Focus more on images because and especially the cadaveric images. The paper mostly images are given. So now next question. Injury to median nerve and cubital fossa will cause. So you have to learn all the nerve injuries in the hand, what they can cause. So the answer was loss of sensation on nail of index finger. Learn the injuries of hand nerves by heart. Then a brainstem cadaveric image was given and it was asked if the following structure has a lesion, what will happen. So if the pyramid is asked, it will lead to contralateral hemiplegia. Ataxia will occur from injury to cerebellar peduncles, and vestibular nuclei injury will cause vertigo. Next, blood supply of brain. This is asked frequently in like 2 to 3 times. It has been asked in different forms. So learn the diagram and practice it. Next, nerve supply of orbit, a coronal section was asked and a muscle was marked. And they'll ask you like what is the nerve supply of that particular muscle, and it has been repeated very frequently. Then a cadaveric image of hand was given, and which tendon does not contribute to its formation. Like this is the extensor digitorum. So palmar interosseous doesn't contribute to it. So the cadaveric images related to hand is also very important. Next, you have to learn the relations of the left kidneys and diagram. Practice the diagram. Next question, next topic is like cubital fossa relations and diagrams. Nerve injury. There was 2 questions in that paper related to nerve injury only, like median nerve, ulnar nerve, and practice the diagram of blood supply of heart. It has been asked very frequently. Next, 2020 questions, like there was a diagram of Tyrion injury and which artery will be injured, that is middle meningeal artery, and it was asked in one of the another forms like which is the underlying bone, that is lesser wing of sphenoid. There was another question about attachments. So you need to learn the attachments and gluteal tuberosity, greater and lesser trochanter, and the actions of that particular muscles which are attached. Next, you have to learn about the type of joints. In that 2020 exam, it was asked middle radioulnar joint is a type of fibrous joint. So learn about different joints. Then you should know about foramen identification, like foramen rotundum, foramen ovale. They'll give you a diagram and you have to identify which is that foramen. Then one of the important question was reticular fibers are not seen in. So the answer is thymus. They are seen in spleen, they are seen in bone marrow, but not in thymus. Hand muscle identification, again it is repeated, so you should know like it was given, muscle was given at the thumb, so which is the muscle attached to that. So you should know all the diagrams of hand. Then in histology, Cilia was marked. Cilia is seen in which of the following structures? This type of questions will be asked. Then muscles involved in abduction of arm and root values of that muscle. So there were 2 questions in that paper. Then you need to learn about the branches of subclavian artery. Then there was one question, itocells, and they are seen in space of Dissay. Then there was a diagram related to piriform fossa, and you have to identify where it is. Then you should know the nerves, branches of facial nerve, and which nerve is injured during peritridectomy or nerve affected in thyroid surgery. All these are important and they are frequently repeated. Then histology of stomach was asked. Then you should know about various association, projection and commissural fibers. Do read it once. Then medial lemniscus, it is gracilis is related to it. Then internal capsule injuries, you should know, like in that exam what it was related, which part of internal capsule will cause contralateral injury, hemiplegia. That was posterior limb of internal capsule. Then histology of pancreas and parotid was asked, and embryology of heart you should know very thoroughly, because they can ask any structure which is what that structure is derived from. So these were the questions asked in 2020. Now let's talk about 2021. Relations of third part of vertebral artery diagram was given and it was asked. Then you should know the various origin of the cranial nerves, the origin from which part of the brain. A diagram will be given. Histology of cerebellum, again very frequently asked. Relations of third ventricle, you should know all the relations of the third ventricle. Diagram was given. Then inferior thyroid artery. I am just discussing the important topics so that you can write it down, and before preparing write down these topics separately so that you should know that you have to focus more on them. Then the nerves in jugular foramen. Then injuries of the hand, again they are asked, like claw hand will be caused by which nerve injury, partial claw hand. And there was this question, which structure is palpable in infraclavicular fossa? So the answer is coracoid process. So you should know the diagram of scapula. And then from embryo, azygous vein was labeled and it was asked, it is derived from which structure? So the answer was supracardinal vein. Then the coronal section of ischiorectal fossa was given and you have to identify the pelvic diaphragm. So again this is very important question. And then one question from histology was histology of trachea. So you can make your own list and prepare topic wise. Then from 2021, next questions were COVID spreads through which route? So it was cribriform plate of ethmoid. Then again, nucleus of nerve supplying the eye muscles. You have to know it. It is very frequently asked. So it was superior colliculus, like for oculomotor nerve. Next, axillary nerve supplies deltoid. So it will cause asymmetry of shoulder, flattening of deltoid will be there. So nerve injuries of upper limb is really very frequently asked. Then there was one question related to branches of internal iliac. You should know the anterior division gives which branches and posterior division gives which branches. Then do read about pharyngeal pouches. Nerve injury, again it was asked. Then epiploic foramen boundaries, a diagram was given, so do read about it. Then in 2022, merocrine, apocrine, holocrine, histology, glands. So do once see the histology, you have to identify them. Then spermatogenesis, a question was asked on that, from basal to luminal side which cells are there. Spermatogonia are located where? So do see histology. Many questions are asked from histology. Again, blood supply of brain. Then about foramens, again there was one question like which foramen is surrounded by 3 bones. So answer was foramen lacerum. Then jugular foramen, again a repeat question, but this time they asked which nerve has a separate canal. So you know 9th, 10th, 11th nerve passes from jugular foramen and 9th nerve has a separate canal. If you have seen the diagram of the floor of jugular foramen, you will know the answer. Read about branches of facial artery. Then lung hilum relations from anterior to posterior, very important. Then do see the nerve supply of leg, which nerve supply the thigh and all that, and ligaments of foot. So these were the topics. You can make a separate list of these topics and focus more on that areas. Thanks for watching. Kindly like, share and subscribe.